this is Dawn at Cook Orthodontics of Dublin. Dr. Cook might have recommended that your child need a palate expander. So let's talk about palate expanders and what they do. So when you came into the office for your new patient exam, you received an information sheet that looked like this that talks about what a palate expander is. So let's talk about the varieties of palate expanders and what they do. Palate expanders attach to teeth differently depending on the bite. We have two types of expanders. This is called a banded expander, and you'll notice that there are little bands, or I like to call them bracelets, on the 6-year molars. That's how that expander attaches. And then we also have a bondable expander, and I like to say that the acrylic hugs the back teeth. It hugs the 6-year molar and a few baby teeth. So let's talk about when we use each one. When we use a banded expander, that would be for patients that might be older and they've lost baby teeth, and so we don't have the option to use the bondable expander. That's when we like to use a banded expander. We also like to use a banded expander when patients have a deep bite or an overbite. So that's the case for the banded expander. A bondable expander we use very often. This acrylic hugs the 6-year molar and the baby teeth, and what it does, when we can hug several teeth, we get a really good skeletal expansion. The turn mechanism is the same on both expanders, just how they attach to the teeth are different. So how does a palate expander work? The palate is the roof of the mouth, and when children are growing, the palate is 2 bones with a growth plate or a suture. So for children that are growing, their palate is in 2 separate pieces. What a palate expander does is it helps the palate grow wider than it would on its own. As adults, our palate fuses and turns to a solid bone, and we no longer have the ability to do as easy of an expansion. So the palate expander fits in the roof of the mouth. It has a turn mechanism, and you'll see a little turn mechanism. You'll see a hole in the center of that palate expander screw mechanism. This is what the key looks like. And so you'll notice that it's a little notched, bent key. The key is going to go into that turn mechanism, and it's going to turn 1/4 millimeter. So every time it turns, the patient will put a check mark on their paper. Dr. Cook usually recommends a month's worth of turns, let's say 27 to 32 turns. We have busy families and busy lives and lots of activities. So let's say you're out to dinner late, or you have a sports activity or practice and you forget to turn the expander key that night. That's okay, don't panic. Don't do it in the morning, don't do it twice, just wait till the next day. So if it takes 30 days to do your 27 turns, that's okay. The day the expander goes on, the patient will get partial braces. Because the mouth is open and dry, we like to go ahead and put the brackets on. They're really just tooth jewelry for that first month. The wire's not attached, but it's fun to pick cool colors. As the expander creates space, a space will actually show up between the 2 front teeth. So the whole function of the braces is to reallocate that space. After a month of turns, we will seal the expander, we put a little dental cement, it doesn't turn anymore, and then it just hangs out for 5 months. So the expander's in there for 6 months total, holding that support while new bone grows in. At that point, we'll add a wire and we'll start to bring those front teeth back together, and now we have space for teeth that haven't come in yet. So when palate expanders are placed, whether it's a banded or a bondable, it's a lot of hardware in the mouth, and so parents wonder, how is my child going to talk and chew and eat? And you'd be amazed at how resilient children are in getting used to it. I personally have 4 children, and they get used to it right away. After 6 months, when the expander comes out, they say they kind of miss that guy. So let's talk about expectations. Because that growth plate is open, it doesn't hurt at all. Sometimes it makes your nose tickle because the floor of the nose and the roof of the mouth are actually a shared bone, so you get better nasal airway. So there's a lot of positive things that come with that. Our tongue gets really excited because somebody new moved into the neighborhood and our spit gets all extra, and so kids can sound a little slurpy. And so that sounds kind of silly, but after 2 or 3 days, I always tell them that their brain will say, hey guys, you can talk and chew and eat normal, so don't worry about that. Our tongue is a very productive tool, so if they feel like lunch is going to get stuck under there, That's okay. I tell them to eat their normal lunch. If food gets tucked under there, maybe it's a peanut butter sandwich or a pizza or a chicken nugget, our tongue will push it out. You can also take whatever you're drinking in the moment for your meal, whether it's water or juice or milk, and do a good swish as you swallow. Patients always get a travel toothbrush in their goodie bag. And so we provide tools for cleaning, but just even a good vigorous swish until you can get home and do a thorough toothbrushing will do the job as well. So depending on what type of expander we do, it may take 2 to 3 visits to make. When we put the expander and the braces on, we schedule an hour. It actually only takes about 15 minutes to cement everything. Most of that time is goodie bag and instruction. The scariest part for parents is they have to be trained as a dental assistant and they have to learn how to turn the key, and you'll be happy to know that's the easiest part. So we'll show you exactly how to do it, and we look forward to working with your child on this smile journey. That's Palate Expanders.